Hello, my name is Alexandra Mejia, and I am a master's student in the Imaging Sciences program at UT Health San Antonio. And today I wanted to do a little presentation just to kind of go over some advancements in the field of imaging, more specifically MRI in reference to MRI brain scans and Alzheimer's disease. So that's the first thing we're going to kind of do today is talk about those advancements specifically, a few, and then we're going to talk about possible applications for the region. And then I kind of wanted to bring it back and talk more specifically about the region, so some statistics just for the San Antonio area in regards to Alzheimer's disease. So first, I kind of wanted to start with just a general overview. So as some of you may know, degenerative diseases they put a really large burden on both the healthcare system and families in the area. San Antonio, and more specifically Bexar County, is really affected by degenerative diseases like Alzheimer's disease. And I'll bring that back and kind of talk a little bit more about those specifics towards the end of the presentation. And here at UT Health San Antonio, we are opening the Center for Brain Health, which is kind of an extension of the Biggs Institute to meet those needs of our population and kind of help people with those degenerative diseases such as Alzheimer's. And then with these further advancements that I'm kind of going to talk about in technology, we can better use that facility space that we're getting brand new and hopefully have a larger impact on our community and potentially other communities outside of our region as well. So the first thing I really wanted to talk about was the deep learning technology, which is very similar to AI. So this kind of AI-like technology is being introduced to kind of help radiologists read images and kind of check them in a way that maybe the human eye can't check. So they use these systems called convolutional neural networks, which are supposed to be very similar to human learning. They're basically supposed to simulate how the human brain works and how we kind of categorize things and place our own filters on information and kind of put them in boxes. So these CNNs is what they call them. They use a multi-layer approach with these learnable filters. So as we would think of something and kind of put it in a box, and then we'd file that away in that box, they basically teach the system to use these filters to kind of place these images when we're talking about these brain scans in these categories. So again, they're trained to recognize very small differences because they are, again, reading the data rather than looking at the image with something like a human eye. They are reading the data and the actual input from the image itself and using that to make their categorizations. And these systems are showing a lot of promise, and it's really showing that a high proportion of the scans placed in the categories after they place them there belong in those categories. So the image that I have here is actually a series of images, both augmented and non-augmented. The studies that I've seen are using augmented to just kind of validate and expand their data set. So they want to use pretty much the same data that would come from that image, but it's going to look different, so it would look different to us, just to basically verify that the system would then be able to tell the difference and still put that picture in the right category. So that's a little bit about that deep learning technology, and I'll kind of go into the applications a little bit more towards the end. The other field of technology that we really are advancing in reference to MRI is image quality and the amount of definition we're able to get from scans. So we're going to talk a little bit about the ultra high field 7 Tesla MRI, which we are actually getting at the new Center for Brain Health. So right now, the standard for MRI scanners has been between 1.5 and 3T. So that's kind of been the norm. And now we're testing 7 Tesla and even higher than that. And they have previously been used for research and are starting to get more and more approved for clinical use. So we are actually getting ours here once that Center for Brain Health opens. So these ultra high field resolution MRI scanners, they have the ability to display microanatomy that before maybe would get missed in traditional scans. So they can delineate vessels and anatomic structures as small as 100 micrometers. So that can make a huge difference in early diagnosis. There's also a lot of promise that they've seen in detecting brain bleeds and very early signs of vessel weakening. So these, like I mentioned before, they're now being approved for clinical use. So we actually can see that resolution work in the field and actually help people get earlier diagnoses. So there also have been some studies that are done to test new coils to go in these 7 Teslas based on the anatomic structure, just to see those certain pieces better. So they can make a certain coil that will go into the 7T for brain scans and different ones for different appendages. So I also wanted to talk a little bit about ex vivo and in vivo scans. So in reference to 7T, there has been a lot of research that's started to get going. A lot of it is in vivo, so with live patients, you bring them in and do the research there. Ex vivo is post-mortem brain scans. So there's a limit in access to ex vivo brain scans. So these scans do benefit us because we're allowed to scan them a lot longer. Obviously, you don't have to worry about patient comfort and keeping them in one spot and worrying about their motion that much. And with that longer scan time, we get higher resolution and higher levels of parcellation, which I can kind of see in this image below. So the top portion are 2 different patients, and that is scanned on that 7T, and the bottom is patient B, so the lower 2 in the top category, scanned on that 3T, and those ones are in vivo. So that was in vivo in the patient, and then the top one is ex vivo with that 7T scanner. So you can see on there that there's a lot more definition in those smaller parts of the brain, the different levels of parcellation. So you can see more different pieces to that patient's brain. And so as I was kind of talking about the deep learning technology before and how it kind of relies on a data set, and you need to be able to give it images to read and put into categories to then learn how to better place future images in categories. There's a limit to the database that we have for 7T and general scans, more specifically for ex vivo scans. And this it limits the tools that we can actually use to analyze these images. So building a database both in vivo and ex vivo is very important going forward to kind of keep up with technology and be able to utilize things like the deep learning technology systems. And then contributing to a database here, either in vivo or ex vivo or both, is definitely the first step that we need to take to get better outcomes in our patients and be able to diagnose and start treatments much earlier. And so, kind of to conclude and wrap things up a little bit, I wanted to talk about the San Antonio area and the possible applications that we could use these tools for. So right now, Texas ranks 4th in the nation for Alzheimer's disease cases and 2nd in Alzheimer's disease-related deaths. 60% of the San Antonio population is estimated to be Hispanic, and people of Hispanic heritage are 1.5 times more likely to develop Alzheimer's, which is why San Antonio and Bexar County are much more susceptible to feel the impact of these diseases. So with that being said, with the 7T scanner that we're now going to have at the Center for Brain Health, we can help build our own database, which would then contribute to the databases that have already been started at different universities across the globe. And we would also be able to use our scanner to better diagnose and more quickly diagnose, I should say, our patients that might have very early stages of Alzheimer's. So if it runs in their family and they needed to come in and would feel more comfortable just having the scan done just to see if there are any signs, we'd be able to have the technology to then tell them what the chances are or to help them make changes in their life that might benefit them in the future. And if we can build that database, then we can start using these deep learning systems, so these CNN networks, and building one of our own to then assist our radiologists in reading these scans and finding the very small changes that might not be as visible to the human eye, even in the very high resolution 7T scans. So overall, I think that we're in a really good spot right now with the research hospital opening and the Center for Brain Health opening, getting this really powerful scanner to then keep increasing our use of technology and utilizing these tools that we have to help support our patients in the area. And I know that I'm really excited to be a part of that going forward. And being a student right now, entering the field of imaging, it's a really exciting time to be here, and I look forward to contributing more to this research in the future, as well as doing some more of my own and bringing things that we might not have access to yet, and just being able in general to help out our patients and treat people better and improve the outcomes of our whole region. Thank you so much for listening, and I look forward to diving in more and hopefully hanging around and presenting more information as I'm able to grab it. Thank you. Bye.